Hey future nurses, let's talk cardiomyopathy. The heart is truly the epicenter of the entire body, and it's responsible for the life of all the other organs by delivering blood. If the heart can't deliver blood effectively, well, that's cardiomyopathy. Cardiomyopathy is disease or malfunction of the ventricular walls, aka the myocardium, that stops effective blood flow. Today we're going to discuss two different types, dilated versus hypertrophic. Comparing and contrasting them will help us distinguish which one is which. Dilated cardiomyopathy is when the heart muscle gets stretched out super thin and weak, and you end up in a pump problem. Your heart's not pumping effectively. But there's many different things that can cause this. There's cocaine and alcohol abuse. There's myocarditis, which is inflammation or infection of the heart muscle. And then there's even thiamine deficiency and hemochromatosis. Think of it like a hair tie. The very new one, it's pretty, it's elastic, it holds your hair just perfect until it becomes your favorite hair tie and you overuse it, a little rough housing to it, and it becomes all thinned out, weak, doesn't hold your hair right anymore, and one day it pops when you try and use it. It's the same concept. So what are you gonna see in your patients? You're gonna see a low EF, systolic dysfunction. You have a pump problem. And if you have a pump problem, you're gonna have hypotension, low BP. Oxygen's gonna be low, so your patient's gonna have some shortness of breath, and you're gonna definitely see tachycardia because that heart is beating really fast and really hard, trying to keep up with all of its faults. You're gonna see an elevated BNP in your lab findings. So now what does the nurse do to manage the symptoms and prevent any advancement? Daily weights, watch that fluid. Sodium restriction, we don't wanna add fluid. And diuretics to get rid of that fluid. You're also gonna see medications like ACE inhibitors, beta blockers, because we want to help that heart slow down, be even better. So you're gonna see all those different medications. And don't forget, give your patient some oxygen, help them be comfortable. Hypertrophic cardiomyopathy. Now you don't have a thin wall problem, now the walls of the heart are too thick. You have a filling problem. The myocardium is thick and stiff, and filling with blood is the issue. So think about it as going to the gym. You go to the gym, you work out, the more weight you lift, the more times you lift, that muscle gets bigger and bigger. That's not necessarily a good thing for the heart. The heart doesn't like it. If I bicep curl 50 pounds nonstop, oh, my bicep is gonna get bigger. But after a while, I'm definitely gonna drop that weight. It's the same concept. I have a filling problem, and now there's not enough space in that ventricle for blood to fill. The heart needs a balanced pump and fill, and you don't have that with hypertrophic cardiomyopathy. So what are the signs and symptoms? You're gonna have dizziness, shortness of breath, fatigue. Your heart is working really hard. You're also gonna have a normal EF, unlike the thin walls where you have a low EF. This EF is going to be normal because you do not have a pump problem. You have a fill problem. And that final muscle deterioration is the drop of that weight. It's death. This is the leading cause in young athletes, sudden cardiac death. So what are you going to do as the nurse? Well, you're definitely going to be giving calcium channel blockers like diltiazem, because we want to reduce contractility. We don't have a pump problem. We have a fill problem. Diuretics to help get rid of that fluid, symptom management, and oftentimes surgery. So let's recap. Dilated cardiomyopathy, thin and weak. Hypertrophic cardiomyopathy, thick and stiff. Dilated cardiomyopathy, pump problem. Hypertrophic cardiomyopathy, fill problem. Dilated cardiomyopathy, low EF. Hypertrophic cardiomyopathy, normal EF. Dilated cardiomyopathy is going to be that used and abused hair tie, whereas hypertrophic cardiomyopathy is going to be that weight drop at the gym. Comment below and let us know what else you'd like to compare and contrast. Happy studying. Don't forget to like and subscribe. Bye.